Welcome to Dewdear Academy. In this video, I have included the important questions from community health and the answers are given with explanation. You can watch this video and also give your comments. And this video will be useful for all job aspirants who are getting prepared for the competitive examinations. So let me start. First question. Human Development Index is a composite measure which uses options: life expectancy at age 1, literacy and infant mortality. Option B, freedom and right to express oneself. Option C, life expectancy at birth, infant mortality and quality of life. Option D, life expectancy at birth, knowledge and decent standard of living. The question is, Human Development Index is a composite measure which uses. So here the correct answer is option D, life expectancy at birth, knowledge and decent standard of living. So on comparing the Human Development Index and Physical Quality of Life Index, that is HDI and PQLI. The components of HDI or Human Development Index include longevity or life expectancy at birth, income and knowledge, income or decent standard of living and knowledge or literacy. And PQLI or the Physical Quality of Life Index, the components include life expectancy at 1 year of age, infant mortality rate and literacy rate. So here in this question, the correct answer is life expectancy at birth, knowledge and decent standard of living are the components that is coming in Human Development Index. Next, second question. Niksha is a central government software. It is used for tracking options: tuberculosis, high-risk pregnancies, high-risk newborn, malaria. Niksha is a central government software which is used for tracking. The correct answer here is tuberculosis. Niksha is a Hindi word which means without TB or eradication of tuberculosis. It is an information communication technology enabled surveillance system under RNTCP to get the notification of TB cases when diagnosed from both public and private sectors, including drug-resistant TB cases. So it is an information communication technology based surveillance system under the RNTCP. And Niksha enables the tracking of all notified TB cases and it was launched in June 2012. TB patients can register with Niksha and it helps in continuous monitoring and treatment adherence of these patients. So here the question is, Niksha is a central government software which is used for tracking. So here the correct answer is tuberculosis. Next, third question. Window period is defined as the time taken from. Options are entry of pathogen to the appearance of first clinical symptoms, exposure to laboratory detection of tissue, entry in cell to expulsion of first viral particle, entry to maximum communicability. Window period is defined as the time taken from. The correct answer is exposure to laboratory detection of tissue. Window period is defined as the time taken from exposure to laboratory detection of tissue. So window period, it is the time between the potential exposure to HIV infection and the point when the test will give an accurate result. It is the time taken by the body to develop antibodies for detection by routine antibody test. And the window period for HIV is about 3 to 12 weeks. So the correct answer here is, it is defined as the time taken from exposure to the laboratory detection of tissue. Next, the fourth question. Identify the correct color pair in triage management. Identify the correct color pair in triage management. Options are option A, red deceased, green needs immediate management, black minor injuries, yellow observation. So in this, which is a correct color pair in triage management? The correct answer is yellow observation. So what is triage? Triage involve rapidly classifying the injured on the basis of their injuries and their likelihood of survival with treatment. It is the classifying the injured people or injured patients based on their injuries and their likelihood of survival with the treatment. And regarding the color coding, for red indicates the victims for immediate resuscitation, that is for within 6 hours, or in immediate need of life-saving surgery, and they are considered as high priority. Yellow indicates the victims for resuscitation or in need of life surgery in the next 24 hours. That is, the priority indicates medium priority. And green means minor illness or ambulatory victims. Green indicates minor illness or ambulatory victims and they are of low priority. And black include the dead victims. They are the least priority is dead victims. So here red is indicating immediate resuscitation or immediate need of life-saving surgery. Yellow is of medium priority, that is who need resuscitation or life-saving surgery in the next 24 hours. And green indicates ambulatory patients and black indicates the dead victims. So in this question, the correct pair, color pair in triage management here is yellow, that is indicating observation. The next is the question number 5. Next question, which vaccine causes ITP as an adverse effect? ITP means idiopathic thrombocytopenic purpura. So which vaccine causes ITP as adverse effect? Options given are MMR, typhoid vaccine, influenza vaccine and Hib vaccine. The correct answer is MMR. MMR vaccine causes ITP as adverse effect. So regarding MMR and measles vaccine, so there are certain vaccine reactions associated with MMR and measles. And these are the rare vaccine reactions and that include the febrile seizures, anaphylaxis, encephalopathy and ITP. So in this question, which vaccine causes ITP as adverse effect? The correct answer is MMR. So these are the 5 important questions from community health. So thank you for watching the video. Hope you like this video. Also share this video to your friends.